guys, it's Lisa with Losing Lisa R&Y. Sorry, it's been a while since I've done an update, but been kind of crazy. I just went back to work 2 weeks ago, and it's been a little crazy. I haven't worked in over a year, so going back to work was quite the shock. But I'm back to the same place, same position, everything, with a few new people. But I am enjoying my job. Unfortunately, I'm training all over again because it's been over a year and things have changed, and they have to make sure I know what I'm doing. But it is nice to be back in the hospital setting and drawing blood and meeting all kinds of new people and making new friends and yada yada yada. So let's start with my stats first. I had the gastric bypass on March 27th of 2018. My highest recorded weight was 291.4, and that was on December 21st of 2017. My surgery weight was 255.8. My current weight is 189 pounds. So I've had a couple different milestones since my last update video. First of all, I am now in Wonderland, which was an awesome feeling for me. I haven't seen the 100s in a long, long time, and I'm so happy to be back in the 100s. And I've also lost 100 pounds, more than 100. The total loss is 102.4 since my journey started in December. My loss since surgery is 66.8. So I'm very close to my goal. I'm like 42 pounds away from my goal. I just saw the PA the other day in my surgeon's office, and she said there shouldn't be any reason I don't make my goal by December or before that. I haven't been working out for the last few weeks, probably a month or so. So I know once I start working out, my numbers will go up again for my weekly weight loss. So I have no doubt that by or before December, I will be at my goal weight of 148 pounds. My surgery was done at Holyoke Medical Center in Holyoke, Massachusetts by Dr. Raftopoulos. Sorry, let me say that again because it didn't come out very well. Raftopoulos. He is an awesome surgeon. He is top of his field, and he's just, in my eyes, he's just the best. I have heard of a lot of people that are having surgeries and they just don't know what they should be eating, or they're eating a lot of carbs and not a lot of protein. He has me on a very high protein diet, no carbs except what might be in the protein shakes that I'm drinking right now, and or bars. I was doing bars before. They've taken me off the bars now, and I'm just doing 2 protein shakes. And for right now, 1 meal a day. I was doing 2, but then I started having some symptoms and pains in my stomach area, so they went in for an endoscopy on Thursday of this week. And I have no ulcer, which is a wonderful thing. Just not sure why I'm having those pains right now. They're not consistent. They're not there all the time. They come and go. Sometimes I get them when I eat or drink. Sometimes I just get them walking around. So I don't understand what the pains are from, but there's no ulcer, so that's a good thing. But when he said to, go back on my regular diet, I asked him, does that mean the 2 shakes and 2 meals a day? And he said, just go with 1 meal a day and the 2 shakes. So that is what I'm doing. Going back to the gym very, very soon. And today I kind of want to talk about vitamins. I know a lot of people, well, I don't know a lot of people that don't think it's a big deal to take the vitamins. It's a very big deal. Once you have either the sleeve or the a gastric bypass surgery, your body doesn't absorb things the way it used to, nutrients wise. So you need to have your multivitamins and your calcium. My multivitamin has iron in it. I'm using the Purity, which is by Unjury, and it's the bypass and sleeve optimized multivitamin multi-mineral supplement. And this one is in the orange berry flavor. It doesn't taste great, I'll tell you that. It's chewable, it doesn't taste great, but I eat it with my meal, and you know, that kind of gets me through eating it. But this is what I take for a multivitamin. Like I said, it's got iron in it. It's also got biotin in it. Hang on a second. Oh yeah, there it is. So I order this online. It's $30, $29.99 for a 90-day supply, plus the shipping, which is about $6. So for a 90-day supply, $30 isn't that bad. Maybe more expensive than, you know, an over-the-counter vitamin, but you're not going to get what you need from that, and this is going to give you everything you need. It's a chewable, it's made for bariatric patients. So, you know, listen to your surgeons, and if they're not telling you, they should be telling you that you need the vitamins, and that you need, you know, specific vitamins for bariatric patients. Flintstone vitamins aren't going to cut it. Those are made for kids. I'm seeing people post online that they're taking Flintstone vitamins. Those are made for kids. They're not going to have the essentials that you need as an adult and as a bariatric surgeon, bariatric surgery patient. And the next thing that I am taking is I am also taking the calcium citrate soft chews. These are by Celebrate. I'm loving that they now have a mixed fruit and a mixed, I don't know what they called it. I'm not even sure what the flavors were. I know one was cafe mocha. I chose not to go with that one right now. But you got 3 different flavors. You got strawberry banana, cream, blackberry, and watermelon. And they're all really good. I like them a lot. They're kind of like my treat throughout the day, and I take 3 of these a day. So I get 90 of them, again, for $29.99, $30. Unfortunately, a 90 count only lasts me a month because I take 3 a day. But that's how much calcium they want me to get. Again, because I had bariatric surgery, I'm not absorbing calcium from other means as well as I would if I hadn't had the surgery. That's why I need the calcium. And I have no problem spending the money. You know, I'm not spending as much money on food anymore. And if I spend $30 a month on vitamins, it's for my health. What's the big deal? And these are $30 every 3 months. So, you know, between the 2 of these, if this is going to keep my numbers up and me healthy, I'm fine with it. You know, I haven't started losing any hair. And my nutritionist, the last time I saw her, said if you were going to lose hair, you would have done it, started doing it by now. And that was a few months ago or a month or 2 ago. And she said there's biotin in the multivitamins, and it's enough to, you know, help with hair loss or hair growth. So that's kind of my rant for today. I know I seem like I'm ranting about a lot of things when I come on here now, but I just see so many posts that people put up on Facebook, on the bariatric websites or the bariatric Facebook pages, and it bothers me that so many people don't know what they should be eating, or, you know, that they need to be taking specific vitamins. Now, do I have to buy these? No, I don't have to buy these specific vitamins, but this is what's recommended by my doctor, and this is what I'm doing. Because he recommended it, and his office recommended it, this is what I'm doing, because I want to be as successful and as healthy as I possibly can. And they know what works, so this is it for me. You know, I understand not everyone can afford the $60 or $30 a month and $30 every 3 months for vitamins. I understand that, but you need to be healthy. You need to make sure that you're keeping your numbers up and your blood work is coming out good. And hopefully you have a doctor that's checking your blood work every, few months. We do it every 3 months at my facility. And I think it's 3, 6, 12. So it jumps a little bit. But no, 3, 6, 9, and 12, I believe. But it bothers me to see people that are struggling with not knowing what they should be eating, or eating things that are all carbs and no protein. It really bothers me that doctors don't follow their patients, or maybe they have a very different program. Okay. And maybe it works for most people. That's great. But I feel like my program that I'm on with the high protein really helps me. It's helping my body heal from the surgery. Now, granted, my surgery was in March. I'm almost 6 months out. But still, my body is still healing. My body is still getting used to its new dynamic. So, I'm going to do whatever my doctor says to make sure that I'm healthy and make sure that I'm doing this right and that I'm going to be successful. And so far, I feel like I have been successful. I've lost 102.4 pounds in December, January, February, March, April, May, June, July, August, 9 months. Not even 9 months, because I started at the end of December. So 8 months. And, I've lost 66.8 of those pounds came since March. So in less than 6 months. I feel like I'm very successful. I'm not losing too fast. I'm not losing too slow. I have yet to have a stall, knock on wood. I do have some body dysmorphia. I walk by a mirror or a window or something, and I look at I see myself, and it's like, who is that? I still go to the plus size section. That's the first place I head to, because that's where I'm used to going. I'm not in plus size clothes anymore. The jeans I have on today are plus size. They're 16W. But I bought them a while back, and I do need to wear a belt with them now because they don't stay up. But I like them, and I'm not willing to give them up yet. They're not looking horrible on me, so I'm still wearing them. And I don't know if I can show you the jeans or not. They're actually capris. You're probably not going to be able to see all of them, but they've got embroidery on the leg. Let's see if I can get my leg up. See, I wouldn't have been able to do this 8 months ago, 9 months ago, whatever the timing is. So anyway, I'm still wearing one thing that is plus size. Everything else is large, extra large, and I think I could even go into a medium on some things. This shirt might be a medium, only because I liked it and they didn't have a large. It could be a large though, I'm not sure. But anyway, large, extra large, and like I said, I think I can start probably even going into mediums, at least on the top. So that's what's going on with me. I gotta get back into the gym. I hate that it's been so long since I've been to the gym, because it's just, I know I lose more, I feel better. I need to tone things. I need to work on this crap if I can. I don't even know if it's workable, but we got to do something here because I could fly away, and I hate that. That right there is my biggest hate about my body right now, is this. And I had this even before I started losing weight. Just imagine my arms twice as big as they are with this. I mean, shirts did not fit well. I hated, I hated it. I still hate it. So that's my biggest, hate about my body right now is my underarm flaps. and you know, you look from the side, and if you can't see the rest of my body, it looks like I have huge arms. I do have huge arms, but a lot of it is you know, loose skin and fat, and I'm just not sure how to work on that, but we're gonna try. We're going to Planet Fitness on Monday to talk to a trainer and hopefully work out a workout. Figure out a workout that's going to work best for me, for what I need, and we'll start working out hopefully Tuesday. Actually, no, we will start working out. Well, Monday I just sit down with her and go over a plan, and then I have another appointment with her to actually go over the machines and, you know, what I should be doing. So I will not start working out until after I do that, because I want to make sure I'm doing everything right and the right amount of reps and all that. So 15-minute video, getting long enough. Now it's going to 16. Sorry, didn't mean to keep you that long. But take your vitamins and minerals. Please, please, please take your vitamins and minerals. It's essential for your health. And have a wonderful weekend. It's Labor Day weekend. Beautiful weather here in Massachusetts. I don't know about you guys, wherever you are, but for the next couple of days it's beautiful. Monday is looking kind of iffy. But have a wonderful weekend. Enjoy your friends and family. For anybody that's getting ready to have surgery, God bless you. Good luck. And just listen to your surgeon. Do what he says, or she. And if you've already had surgery, just had surgery, good luck in healing. You know, again, listen to your surgeon. Hopefully you heal quickly and you are successful in your journey. May we all have a successful journey. Have a wonderful weekend. Thank you for watching. Bye-bye.